Healthcare did not become strained overnight. It happened slowly, one shift at a time, one compromise at a time, one moment where someone saw something wrong and they stayed silent. Not because they didn't care, but because speaking up in healthcare often comes with a cost. Careers, reputation, isolation. Over time, the silence became normalized. Clinicians learned to absorb more patients, more documentation, more pressure, more responsibility. And somehow, the expectation remained the same. Keep going, handle it, don't make waves. But inside the system, people know the truth. They know when conditions become unsafe. They know when systems begin to strain under their own weight. They know when professionals are expected to carry burdens no workforce should carry alone. And yet, the structure around them rarely allows those truths to surface without risk. Healthcare has built extraordinary systems for treating illness, but it has never built a system designed to protect the professionals responsible for delivering the care. For decades, the workforce has been expected to adapt, endure, and absorb whatever pressures the system creates. Resilience became the answer to structural problems. But resilience alone cannot stabilize a system. At some point, someone has to say what many inside healthcare already understand. Waiting for someone else to fix it will never work. Not the executives, not the policymakers, and not the institutions that were built within the same structure. Real change inside healthcare has always come from the people who live inside of it. The nurses, the physicians, the respiratory therapists, the technicians, the professionals who show up every day and carry the responsibility of patient care. The truth is simple. Healthcare does not run on buildings. It does not run on policies. It does not run on technology. Healthcare runs on people. And when the workforce becomes strained, the entire system becomes unstable. The realization is what led to the creation of the Nursing Special Forces Association, not as a protest, not as a political movement, but as a recognition that healthcare needed something it had never built before. A professional structure dedicated to protecting the people responsible for holding the system together. Because when professionals are protected, they speak. And when they speak, systems improve. And when the workforce is strong enough to be heard, healthcare becomes safe for everyone. NSFA exists for one reason: to ensure that the professionals responsible for delivering care are never expected to carry that responsibility alone. Because the future of healthcare will not be decided by systems. It will be decided by the people inside of them. And when those people stand together, they become stronger than the structures that once kept them silent. That is the reason this movement exists. That is the why.